and I am a case manager for Healthy Living, our number one goal, which is a program for Chicago Area Project. And yes, for today's show, we're going to go a little bit into National Black HIV/AIDS Awareness Day. The day was actually earlier this month in February, but I didn't want to miss out on the chance just to talk a little bit about the subject, about why it's an important day to talk about, to be aware of. And I know we've talked about HIV a couple times before on this show, but it does affect different populations differently in terms of the population and in terms of why it affects these populations differently. We're going to get a little bit into that and a little bit into some risk factors, things like that, prevention, of course, which is very important, advocacy and things like that. And before we get into that, I want to do some quick announcements, just letting you guys know about upcoming events and upcoming shows that we have coming up, which includes an interview that I plan to have with one of our interns, Mesa Hassan. And so she will actually be interviewing with us sometime next month. So look forward to that in the next couple episodes. And then some upcoming events that I will, of course, show some flyers for as soon as I'm able to receive them. They're still kind of in the works. But one of them I will be able to share next time I'm on is for a health fair event happening sometime in March, so next month. And then we do have another one upcoming in April, which is going to be the prom event from provided by Gift of Glamour, where they provide free prom dresses to high school students, and we give out a lot of information on there. We were actually there last year supporting their cause and giving out information on substance use prevention, Narcan information, how to use Narcan. And I believe I talked about it in an earlier episode as well. So yeah, look forward to that as well. More information is coming up on that. And the flyer will be coming up as well. But yeah, that won't be until April. So we'll keep you all updated on that. And you can also stay updated on our social medias for Healthy Living CAP and CAP Healthy Living on Instagram and on Facebook. So feel free to check us out on there. But yes, so going into our topic for today, which is National Black HIV/AIDS Awareness Day, which was February 7th. That is a day that was first celebrated in 1999, and it's meant to highlight the importance of HIV awareness and how it disproportionately affects the Black community. So we're going to go into some statistics about that. So, and more specifically, thinking about Chicago, a total of 627 new HIV diagnoses were reported in 2020 in Chicago specifically. So it's actually good compared to the numbers in 2016. So this is the lowest number since actually 1987, and it represents a 29% decrease when compared to 2016, when there were 888 new cases in that year. So, or new diagnoses in that year. So it's really important to think about how prevention has impacted this, education, advocacy has impacted more awareness about HIV and AIDS, and just thinking about how we're able to further decrease that number and decrease new diagnoses by educating, advocating at the state and local levels, as well as policy changes, things like that, which is really important, and accessibility to healthcare, right? So yeah, that's really important and really good to think about. Also important to think about that recent statistic was from 2020. I actually tried looking into more recent, like 2024, 2023 data, but Chicago doesn't have that information, or not that I could find. They had some briefs, data briefs that they've done on HIV specifically, and so I'm hoping that they make another one of those for this coming year, or hopefully update or release the one for 2024, so we can get more updated data on that and just see kind of where the trends are going, right? Because we want to learn more about how cases are either increasing, decreasing, why that is, and things like that. So yeah, and also to think about, since that was in 2020, it was the lowest that it's been, and that could also be due to COVID. It's not 100% sure, but since these statistics were from 2020, which is when lockdown started and a lot of people were staying inside, not really going out and doing things, that could also impact the data. So it might have gone up since 2020. But yeah, so that's something to kind of keep in mind. And according to the U.S. Department of Health and Human Services, their data report shows that Black men were 7.6 times more likely to be diagnosed with HIV than white men in 2022. And then for Black women, they are actually 10 times more likely to be diagnosed with HIV than white women. So these are some important statistics to think about and to be aware of, right? And so with that, they also said that Black men were 6.4 times more likely than white men to die from HIV infection. And so it kind of makes you think about, why is this community more highly affected? For those who may not know a lot about why, we're kind of going to discuss a little bit about that today, discuss the risk factors, what could impact people from getting treatment. Maybe people aren't getting tested and why they're not getting tested. So things like that, right? And so thinking about lack of healthcare resources or medical deserts. If you think about medical deserts are very similar to food deserts. And so what that means is that there's basically a lack of resources in a specific area, in a community, and how there might be no nearby healthcare facilities or places where people can get tested for HIV in their area. So that might make it harder for the people to be able to get treatment. They might not even be aware that there's treatment by them because they don't know about the resources that are available to them. And yeah, so they are less, Black neighborhoods that are predominantly Black are less likely to have, or are more likely to have, a lack in resources in their communities. So like I said, that can include maybe little to no healthcare facilities, and like I said, medical deserts. And that can be harmful, right? Because if they have nowhere to go in their area, they might not be able to travel far. And so that can also affect likeliness of going to see a doctor for whatever the case may be, but also specifically HIV treatment and HIV testing. Also, another harm, and something that impacts all communities, but also specifically within the Black community, there is stigma. And like I said, this isn't all communities, but with stigma, it kind of happens mainly because there is, like I said, a lack of education in HIV, what it is, how it's transmitted, and just kind of the guilt or shame that might come with coming out and talking to family and friends about possibly finding out you have an HIV positive test, right? So people might not want to disclose that. People might be too scared to disclose that, or scared to seek treatment just because they're worried about the shame that they're going to feel within their community, or shame or guilt that they might feel from others that might be shaming them. You know, people that can potentially feel isolated because of sharing their HIV status. So that can be something that they're just worried about opening up about, right? So that can also affect their willingness to go get treatment. So once they find out that they have HIV, it's important to get treatment. It's important to look into medications, things like that that can help with HIV and prevent the spread of HIV. So yeah, these are important things to kind of think about, and how stigma kind of affects these things, right? And so they might not know where they can get tested, and they also might not think that they can afford it. Even though there are a lot of free resources available for HIV testing, these are some things that the community might not know about. And yeah, like I said, well, another one of the risk factors is also economic impacts. And so with that, thinking about this population, Black African American people are more impacted by poverty than most races in the U.S., so they face more challenges when wanting to receive treatment or medical care. and may not be able to afford to do so, right? So with treatment for HIV, you have to take medication consistently, right? And so with taking medication consistently comes a lot of payments for medication, for pills, even doctor's appointments, right? Because you have to do a lot of follow-up appointments just to make sure you're on the right track. And so this comes with a lot of costs. And so this can, even with health insurance, it can be a little tricky as well. So I think it's important to think about just the cost of this treatment and why people might, they might go to that initial appointment, they find out how much it costs, and they're a little hesitant to return, right? Because they might not be able to afford it. And so that can be an issue, right? And then that won't help with preventing the spread of HIV. Or maybe if they receive treatment for a little bit and then maybe their insurance stops covering the treatment, then they're not able to continue with that, right? And so thinking specifically, which we'll get into a little bit later too, is also the specific types of treatment that HIV, people with HIV, or if you're with someone that has HIV, there's different medications that you can take, such as ART, PrEP, and PEP. So those are some of the treatments that can be taken. And so these things you need to take consistently. It's not a pill that you just take once or twice. It's something that you have to take daily. So with that comes a lot of costs, and that can range from hundreds to thousands of dollars, depending on the medication and your specific situation as well. And then even with the costs of having HIV, if you have HIV, you are more likely to be impacted by something like the flu, right? Which is something that people take vaccines for. And so you get the flu, you're sick for a few days, and you're fine. But somebody with HIV, if they get the flu, it hits them really hard. And so with that, some people end up needing to be hospitalized, taken to the ER because it affects their immune system really heavily, or they might have to take extra medication for that. So depending on whatever they get sick with, it takes a really big toll on their immune system. It takes them way longer to recover. And so there are other costs additional to HIV treatment costs and things like that. So this can prevent them from continuing treatment, which doesn't help with, like I said, preventing spread of HIV. And some other things, they may also face challenges, so kind of related to economic issues. People might not have cars or affordable means of transportation, or even depending on the area that they live in, there might not be any good, reliable transportation near them where they're able to get access to go to a medical center, get tested, or things like I said, consistently go to appointments if they have no means of transportation. So that is something that can also affect consistency in maintaining treatment and things like that. So yeah, very important stuff to think about. And so a little bit about preventing HIV and a little bit about the basics, which I've been over before, but it's important just to kind of get a refresher so that we all know and can kind of keep in our brains how to prevent HIV so that we can share it with others. So with the basics, it's have safe sex, because that's one of the main ways that HIV is transmitted, is through unprotected sex. So using condoms, dental dams, things like that to maintain to just make sure that you're being safe and not spreading anything in case you may or may not have HIV, especially if you don't know if your partner's been tested. Also being careful, making sure that you get tested regularly. And so I think the CDC suggests getting tested once a year. It's not anything you need to test very frequently for, especially if you have one partner or no partners. Just making sure that you're testing yourself, and then having that conversation with your partner about asking them if they've been tested, especially if you or someone else is involved with multiple partners. That's something that can be of higher risk of getting HIV, especially if you haven't had those conversations and you know that they haven't gotten tested for it. Just encouraging people to get tested for HIV is very important. But yeah, so then taking medications, of course, like I've said, and then making sure that you are taking that consistently, because that can also help with not spreading or contracting HIV, right? And yeah, so thinking a little bit about that, and then specifically with ART, like I said, that's one of the medical treatments for people with HIV. That is something that you can take that helps with viral suppression. We won't get too much into viral suppression, but what that basically means is that you're non-detectable for HIV, and that means, so viral suppression is that you won't be able to spread HIV to someone you are having relations with. So if you are taking your medicine consistently, daily, not missing a day, then you are on the right track to viral suppression. And so thinking about all those things together comes the terms continuum of care. And so with the terms of continuum of care, what does that mean, right? So continuum of care is basically making sure that your client that you're working with, if you're someone in the medical field and if you're working with people with HIV, you know, continuum of care, and how basically that's how you maintain suppression, you educate people on HIV, you make sure that they are being steady and consistent with their medications, so that way that they're able to live the healthiest lives that they possibly can. And so that's really important for people to know. And so it goes from diagnosis, which is the beginning, to viral suppression. And so the steps to that are HIV tests. You find out you're positive, then you receive treatment, and then after that you are able to follow up. Make sure you follow up on your appointments with your doctor regularly, however many times you need to meet up with your doctor. And then consistency. I will be saying that a lot just because that's something that's really important, especially with HIV treatment. So consistency in taking your medication, and then HIV then becomes undetectable. And then that's how it prevents from transmitting to others, right? While we do say that it is untransmittable, we still highly encourage safe sex practices. So still using a condom and things like that to make sure that you're not able to spread HIV to anybody else, just to be the safest way possible. And then, yeah, so those are very important things to think about. Just also, like I said, prevention, education, spreading the word through advocacy, through workshops, just making sure that people are out there educating their communities, especially if you work in social work or if you work in specific organizations that are meant to educate people on HIV and HIV prevention, which are things that my program are able to do through workshops, virtually and in person with youth and with adults, just because it is important to educate the youth, but a lot of adults don't really know. Not to say that a lot of them or all of them don't know, but many adults might not know about HIV, how it's spread, because, early on when HIV was first discovered, there was a lot of stigma on how it spread, right? So a lot of people thought that it was spread through just touching somebody, hugging them, sharing maybe like a drink with them, sharing food with them, like through saliva or things like that. That's not how HIV is spread. And so that's kind of where a lot of the stigma started, right? So that's how people with HIV became more isolated. People were looking down on them, wanting to avoid contact with them, being near them. And so that's kind of what happened in the beginning, people not being as aware of why or how HIV is spread. So hopefully educating, like I said, through, these kind of conversations, people are able to be better informed about this topic. So that way people are just more understanding of people's situations and being able to help people open up about their HIV status. And just understand that it's okay and that people with HIV are still able to live very normal lives, and that you can't look at anybody and see that they have HIV, right? Because they're just like anybody else. And so just making sure we empower them to live the healthiest lives that they can with HIV, and not letting HIV define them is something that's really important, right? And like I said, advocacy is something that's really important. And we're going to talk about a couple advocates that are very important. I've talked about Magic Johnson, I believe, a couple times, and he's been an advocate for HIV. He is someone that's living with HIV, and he's been very open about it, having discussions about it. So it's very important for people in their positions who are very widely known, are on TV a lot, right? And the Black community and people in the HIV community look up to Magic Johnson, right? As well as many other advocates that have been very outspoken about HIV and advocating for it. There's one that I had recently learned about, and his name is Arthur Ashe. And he's actually an American tennis player, and he actually contracted HIV through a blood transfusion when he was having heart surgery. And so during his surgery, he was getting blood from another, patient who had donated blood. And I think this was before they were kind of checking for people with HIV in their blood system. So he received blood from somebody who had HIV. And so he contracted HIV in that way. And just know that this is something that is very rare today. This happened in the 90s or the late 80s when he contracted it. Or mid to late 80s. And so it is a 1 in 1.5 million% chance that you are likely to get HIV through blood transfusion during surgery. That's not something that is very common anymore. But he's one of the rare individuals who's contracted it that way. But ever since then, he's been very outspoken, advocated for the HIV community and people with HIV, also just advocating for accessibility to HIV and more funding towards this cause. He even spoke for the World Health Organization during World AIDS Day and advocated for HIV funding and things like that. So it's really important to think about advocates, people that you can relate to who care about this cause and can hopefully encourage others who may be living with HIV to come out and to just normalize it more and not make people feel shame or guilt for having something that was out of their control, right? Because nobody chooses to have HIV. So some other advocates worth mentioning, like I said, Magic Johnson and Alicia Keys, actually. She's not someone who has HIV, but she has been an advocate for HIV. I believe she traveled to Africa where, a lot of families and children are highly impacted by HIV and AIDS. And she kind of saw that and wanted to help that community and just other communities with families living with HIV. So she has an organization called Keep a Child Alive. So look that up if you're interested. I just found that out. But I think it's really cool that there's a lot of people, even people who aren't living with HIV, being advocates. You don't have to be a part of that community to advocate for that community. So just making sure that you are staying educated, informing others about these causes, about free resources that are available. Free testing for HIV is available in Chicago specifically. You just have to know where to look, and also make sure if you do have insurance that it is covered, wherever you go. But looking into those specific places, right, where your insurance covers these tests. So making sure you're aware of that. Chicago has a lot of great resources. We also have a lot of great resources if you are interested in finding out. There are also like free testing vans that can kind of come to specific areas, like I said, with medical deserts or places with high traffic, just to kind of make people more aware of it. But yeah, there's a lot of ways you can kind of get involved, stay educated, just to make sure you spread the word and share awareness and the importance of the awareness. But yeah, thank you so much, everybody, for taking the time to listen to my show today. I hope you have a good rest of your evening, and I will see you all next time. Thank you. Have a good night.